Back to Fox 5's On the Hill Live this Sunday morning. The Republican budget bill makes major cuts to Medicare and changes. Democrats say those cuts will mean millions of people will lose their health insurance. Rural hospitals especially say the impact on them could be devastating and that some could actually go out of business. Valley Health operates several hospitals in Virginia and West Virginia, as well as medical offices, urgent care facilities, and long-term care centers. It is a not-for-profit health system that serves many of those rural communities. Chris Rucker is the Chief Administrative Officer at Valley Health and joins us this morning. I want to lay out before we get into this conversation, Medicaid is not Medicare. Medicare people get when they're 65. Explain to folks what Medicaid is and why it is so important.
Medicaid is a health insurance that covers a variety of folks that aren't on Medicare, which is health care for the older Americans. Medicaid is disabled individuals, it's people in poverty, it's pregnant mothers and their children, it's the elderly, often in nursing homes, elderly that are indigent and can't afford a nursing home. So it's a wide variety of folks.
We have heard nationally that rural healthcare systems like yours could be adversely impacted by all of this. Why? What is special, what is different about a rural healthcare system as opposed to major metropolitan areas?
That's a great question. Medicaid is a disproportionate larger payer. There's more Medicaid individuals in rural areas where there's already a shortage of access to care. And because of a variety of factors, there's also a higher incidence of chronic disease in those communities. There might be a lack of availability of fresh foods and transportation issues and lack of employment opportunities.
So if somebody is sitting here and saying, well, I'm not on Medicaid, why is this going to affect me? Could it affect me?
Yeah, I think a lot of folks are asking themselves that. And for that, you want to zoom out a little bit and think of the healthcare ecosystem just as one large ecosystem. And if you're removing money from caring for patients, that squeeze is going to have to be felt somewhere. So it's not just the Medicaid patients that may see longer waits or may not be able to see a specialist. It's really going to impact all of us.
Do you know right now, we're only a couple of days since this was signed into law, what the financial impact would be on your healthcare system? Is there anybody out there on the federal end telling you, you at Valley Health, this is what you can expect?
Well, the feds haven't done that math for us, and so that's left us to do it. And we would say in a broad range between $40 and $90 million a year in healthcare, so in healthcare dollars.
That sounds unsustainable. That it would tip you to a financial position that the way forward would not be good for you.
That's very true. It is unsustainable. Most hospitals, nonprofit hospitals, operate on a 2 to 3, 4% margin, meaning there's 4 cents of every dollar left over at the end of the year. You take $90 million out of the equation, that's a big loss.
Is there any possibility that some of this could be actually stalled? Some of these cuts are looking at over a 10-year period. You're looking at a decade out. How soon are you going to feel the impact of this?
I believe we'll start feeling the impact fairly quickly, especially as it relates to those with work requirement issues or that were part of the Medicaid expansion population. It's yet to be seen what the individual states are going to do. It's a significant economic burden for them to close the gap on. So we know that they can't fix it, but what each individual state is going to do is also a factor.
Well, the two that you deal with, Virginia and West Virginia, Virginia actually did do a Medicaid expansion, following the Affordable Health Care Act. Have you gotten word from either the state of West Virginia or the Commonwealth of Virginia whether they'd be able to step in and, fill these vacancies?
No, they've indicated they're aware, and they're certainly sensitive to what our needs are. But in terms of how to address or solve the problem, not yet.
When do you think you might have some kind of guidance for folks as to what services that you might have to adjust because of these cuts?
We'll need to know a little bit more, as I said, from both the state Medicaid programs and what it really looks like. But I would expect over the next 6 to 12 months, we'll start to have some real plans for what that looks like.
All right, so people really have to pay attention to this as we move forward. It's not over yet.
It's not, definitely.
All right, Chris Rucker is the Chief Administrative Officer at Valley Health, serving the Commonwealth of Virginia and parts of West Virginia as well, too. We thank you for joining us live this morning.